In this section, we will discuss muscular and connective tissue diseases. So let's talk about the dystrophinopathies, or X-linked disorders of the muscle. The two you have to know here are Duchenne's muscular dystrophy and Becker's muscular dystrophy. Duchenne's usually presents in early childhood. You get delayed milestones, delayed sitting, delayed crawling, delayed walking. CK is about 10 times greater than normal on blood examination. They have proximal weakness causing a waddling gait and difficulty climbing. In the boys, you'll see the Gower maneuver as they try to rise from a supine position, as they use their arms to stabilize and supplement the weak pelvic girdle muscles. Complications include heart failure for these kids. Becker's muscular dystrophy is a later onset skeletal muscle weakness, not quite as severe as Duchenne's muscular dystrophy. The individuals remain ambulatory into their 20s. Heart failure, again, is common in this disease as well. For collagen structure, remember that with collagen we have these subunits, right, that have to form together and make like this ladder to form these big collagen chains, these big collagen membranes that we need. So the function of each fibril is dependent on many copies of a protein unit, and mutations that influence protein quantity can be damaging by a gene dosage effect, but qualitative changes can be more insidious, and the mutated collagen protein is included in the fibrils. So the disorders of collagen that you're going to want to know: OI, osteogenesis imperfecta, and Ehlers-Danlos. OI is most commonly type 1, autosomal dominant. Babies are born with blue sclera, that's the giveaway for the boards, and have many bone fractures. Many null mutations or loss of function mutations are found in the COL1A1 on chromosome 17. Type 2 is more rare but also more severe. Point mutations here are in the genes COL1A1, just like type 1, or COL1A2. This is an autosomal dominant type disease, and the effect is a gain of function dominant negative, like we talked about in earlier sections. So we get something wrong with the collagen subunit that messes up the entire structure. Ehlers-Danlos is type 4, best studied and also the most dangerous. This gene is COL3A1. Autosomal dominant, the skin is elastic and joints are hypermobile with easy bruising. The risk of death for these people comes from major artery rupture. Now another disease that's musculoskeletal is the Marfan syndrome, 1 in every 3,000 incidents on chromosome 15, and remember we said this is the fibrillin gene, autosomal dominant inheritance. So in Marfan's we see defective fibrillin in various tissues. We see it in the tissues of the heart, the blood vessels, the muscles, and the eyes. Phenotypes here we've discussed earlier: generally tall and slender individuals with long extremities and hyperflexible joints, commonly have cardiovascular problems including aortic dissections and mitral valve prolapse, also have eye problems including dislocated lenses, cataracts, and retinal detachment. The treatment for Marfan syndrome is symptomatic and preventative with routine EKGs to prevent heart deterioration and also to watch for aortic dissections. That concludes this section of the lecture. Next, we will discuss lung diseases.